name is Buechel. I lived in New York City my whole life. Lived in Queens, retired New York City fireman. I had, over my years in my career, I had a couple of knee surgeries, and over the time, my meniscus was repaired 3 times and the cartilage had disintegrated. And I was experiencing for about 5-6 years a lot of pain. And I've gone to other doctors and they always said that, you'll have to have total knee replacement eventually. And I was fighting that tooth and nail. And I overheard through another doctor about a partial knee replacement. I did some research, met with Dr. Buechel, with my wife and I. He explained what he was going to do, his procedures. He explained how the recovery would go, and he answered all my questions, my wife's questions about, what it was going to take. And we were confident, and I decided to go with Dr. Buechel to do the surgery. Dr. Buechel performed a partial knee replacement on my left knee. I had bone on bone on that knee. It was very painful. He explained that it was going to be through robotics, and explained the whole procedure. And he just gave me so much confidence in how precise the procedure would be, and it would greatly reduce the pain I was experiencing, and I wouldn't have any complications from it. I probably went into the hospital at 8 o'clock that morning. The surgery was at about 11, and I was walking out of the hospital by 8 o'clock that night. He wanted me to just do the ice machine. He wanted to take Advil and Tylenol for pain. He did give me some other stuff for more potent. I took maybe 1 or 2 of them for the entire procedure since the day of the surgery. Most of the time I didn't need it. I'm fine now. It's been a little over 3 weeks. I don't take any Advil or any Tylenol now. They gave me a walker to walk to the car, and that was it for the walker. The next day I used a cane for 1 day. The following Monday or Tuesday I had the therapist, and they were explaining to me what they were going to do about teach me how to walk and use a cane. And they were so impressed that I was just walking. I walked in and walked out, no problem. My surgery was on a Thursday. Election day was, 4 days later. I voted and walked into the school, and I saw a man sitting on the bench, and his whole leg was opened up. He had that long scar down the front kneecap. And I asked him, when did you have that done? And he said, about 6 weeks ago, 7 weeks ago. And he asked me, I said, I had it 4 days ago. And he was like shocked, like, you had it 4 days and you're walking? And I said, yeah. He was shocked, and he said he wished he knew that he could do a partial. And I was like, I feel great. So at that moment, I knew I made the right choice.